Dr. Iqbal, if a person cannot find a donor, right, can he or she do a transplant overseas? I mean, we've heard of this. And what about the legalities of transplantation? Can we touch on that a bit as well?
Yes, Sham, very good question, because it's actually illegal to be involved in commercial transplantation where you pay an agent to get a kidney, and rightly so, because illegal organ transplantation, or you call it transplant tourism or commercial transplantation, is unethical because middlemen are involved. So you can imagine if it's like a legal trade, only the super rich can afford it. And these transplants are actually done illegally in these countries. So patients do not have an identification or a reference to the doctors who perform the transplant. And if you hear the stories, it's really like a Hollywood movie playing out. It's not an exaggeration.
Why don't you tell us about the type of organ donor? The difference between living and deceased donor. I think some people want to know this.
Very important as well, especially when it comes to kidney transplantation, because living donor is basically when the person donating is alive, and usually they are family members, relatives, so brothers, sisters, it can be mothers to children or vice versa, or spouse. And because they are living, they can only donate certain organs, and that's only a kidney, because as I said, we have 2 kidneys,
right,
and we can survive with 1 kidney,
okay,
and a small part of the liver. Whereas deceased donor, the donor is dead, and it's not it's brain dead. It's not dying of old age or dying of a heart attack or dying of an infection, for example, or cancer, for example. So when you get an organ from a brain dead donor or deceased donor, so we can take all the organs like kidneys, liver, lungs, heart, tissues like cornea, bone, for example, right? And it's very important to understand this, because the most important thing is the disease program in any country.
I know, some people, a lot of Malaysians, they'd be motivated to do the right thing, to donate, to do a lot of donations. Now, if they ever feel like they want to donate any of their organs upon their passing, or upon being in a state where they can donate their organs, what sort of criteria do donors have to meet to be able to donate a kidney, and the risks to the donors?
Okay, so you have to answer that. Okay, I'll just answer that in terms of if they wanted to be a donor, a living donor. Okay, that means if they wanted to give a kidney to their family member, for example, they themselves have to be well. So they cannot have diabetes, hypertension. They may have mild hypertension, but they have to be free of infection, cancer. They have to be well themselves.
Okay.
So to live with that 1 kidney themselves, you see. So you don't want them to give you a kidney and then them ending up a kidney patient themselves in a couple of years. Right?
Okay.
So that's being a living donor. But for a deceased donor, you can be at any age, and as long as you're healthy, basically, then you can sign up to be an organ pledger.